morning. So if you were here yesterday, you will remember this slide that I showed you. My personal 4 superstar ingredients of over-the-counter skincare. And I promised you that I would talk about retinol in more detail this morning. And that's exactly what we're going to do now. And the reason why retinol is one of my favorite ingredients, if not my absolute favorite, is that it's a multifunctional ingredient and it offers a lot of benefits. And it is a true biostimulator in the true sense of it. So it activates our dermal fibroblasts not only to produce more collagen, elastin, and also HA, but it also, on the other side, reduces the degradation of those matrix components. So it inhibits the matrix metalloproteinases, MMPs, so it stops degradation of collagen and other matrix components. It also increases epidermal cell turnover, so our skin renews itself and looks fresher. And then there's a really important function that improves the dermo-epidermal junction, you know, that undulating border between the epidermis and the dermis, which flattens as we get older. And that's one of the kind of downfalls of aging skin. So what retinoids can do is they can make it much more youthful looking in the shape. And of course, it helps shedding off old pigment as well. And this is the retinol itself, vitamin A, but when we talk about retinoids, what we're meaning is the whole group of vitamin A derivatives. So there's a lot of confusion about terminology. What is retinol versus retinal, retinoid, retinoic acid? So I'm going to talk you through that to really clarify the terminology of these. So let's start with food sources of vitamin A. So we've got preformed vitamin A in certain foods like liver, fish oil, milk, and eggs. And then we've got provitamin A in other foods, green leafy vegetables, certain oils, etc. But what we're talking about today is really topical retinoids. So these are, of course, used for a variety of indications, from aging to pigmentation, also for acne, and for keratotic disorders such as psoriasis. And we can divide this group of retinoids, so which meaning a molecule based on vitamin A, into prescription derivatives and over-the-counter derivatives. So Treatinoin is our retinoic acid, so it's vitamin A acid, basically. One of the brand names is Retin A, and a lot of our clients or patients will call any tretinoin Retin A. So you have to know, like Hoover, Retin A is actually not a name, but it's a brand, and we shouldn't really use that name for this ingredient. So we call it tretinoin or retinoic acid. And that's the classic prescription retinoid, which is still the gold standard essentially. But we've got newer synthetic prescription retinoids such as adapalene, indifferent cream or gel, which I wouldn't recommend the gel, tazarotene, isotretinoin, both topically and of course orally used for acne in the form of Roaccutane or Accutane. Alitretinoin is the newest out of those. It's an oral retinoid used for hand dermatosis. So all of these are prescription ones, and I'll come back to them in a minute. And then we've got a group of over-the-counter retinoids. So the classic one is retinol, which is a vitamin A. Retinal is retinaldehyde. I'll show you the chemical formulas in a moment. And then we've got a group of a variety of retinoid esters. The most common one will be retinol palmitate. So if we talk about those in a little bit more detail, Treatinoin is still the gold standard. This is just a very small selection of studies, but what the research shows that it induces both collagen 1 and 3, our most abundant collagens in human skin. It also induces other matrix components such as HA, elastin, and it reduces MMPs, so it reduces the breakdown of those, and it induces TIMPs. I don't know whether you know those. So they are the tissue inhibitors of MMPs. Okay, so it really attacks, or not attacks, but it preserves the collagen from all angles that we can think of. But also it improves the quality, especially of our elastin fibers, which is really declining in quality after chronic sun damage. And then it has even a reduction of micro-inflammatory benefits, and of course, as we all know, the epidermal cell turnover. So that's our tretinoin. So it's really multifunctional, and it does all of those functions via something called retinoic acid receptor, and this is in the nucleus of our cell. So the retinoic acid first of all penetrates into the cytoplasm, then further into the nucleus where it docks onto the retinoic acid receptor, and then causes a transcription of our DNA, producing different types of proteins. And unfortunately, the Retin-A, the brand Retin-A, has been discontinued in the UK quite a few years ago. So we now, sadly, don't have a prescription tretinoin on its own. We've got one mixed with antibiotics, which is not really used for anti-aging. But we don't have a sole tretinoin product in the UK. So we have to get it in from international pharmacies, which is possible. Or alternatively, some clinics have started using the newer synthetic retinoids, prescription retinoids, which are still available on prescription here. And the most common one is the differin cream. There is a cream and a gel. If you want to use this for anti-aging purposes, please do use the cream, not the gel. The gel is in a horrible alcoholic base, and it is okay for very seborrheic acne skin, but not for anti-aging. And you can see that there is, good emerging evidence on photo damage and anti-aging effects of adapalene. Certainly not as good as the tretinoin evidence, but if you can't get hold of tretinoin, if you want to use a prescription one, then this is a good alternative. One of the issues, of course, with any prescription retinoid is the potential for irritation and the development of irritant contact dermatitis. And what you will hear from your patients in the vast majority of cases is that will come back and will tell you, I'm allergic to it. I can't use this. And this is so important in education to explain the difference between an allergic contact dermatitis and an irritant contact dermatitis, because vast majority of these patients are not allergic to the ingredient. They've simply overused it for their own individual skin tolerance. So irritant contact dermatitis, dryness, redness, flaking, itchiness, kind of irritation, tightness, and very simple, stop for a few days, simple moisturizer, and then start, but more slowly. But because of those potentials for irritation, there is a huge place for over-the-counter retinoids. And also, of course, for those patients who don't want to use prescription items, who don't want to spend another couple of £100 on a consultation with a dermatologist to get a new prescription several times per year. And the good news is that the over-the-counter ones now, if there's a well-formulated one, can really get the same benefits as a prescription one. So the three most common ones used is retinol, retinaldehyde, and retinol esters. And if you look into what they're doing, the matrix remodeling, photo damage repair, and of course all of that usually with less irritation, you will see that what they do is very similar to tretinoin. This is retinol vitamin A chemical formula. And the reason why it's so similar is because they use the same receptor. Right, so there isn't a retinol receptor in the nucleus. All we have is a retinoic acid receptor that I introduced a few minutes ago. So the reason why retinol can exhibit exactly the same effects as tretinoin, maybe not quite as strongly, but the same qualitative effects in all aspects, is because it uses the same receptor. So how that works is, if you have retinoic acid, it goes into the nucleus, docks onto the receptor, and there we go. If you have a retinol, or even a precursor of this, like a retinol ester, the retinol goes in, It is then, via several steps, converted into retinoic acid, which then goes into the nucleus and does exactly the same as our tretinoin does. And it is converted via this chemical reaction. So retinol here gets converted into retinal, which is the retinaldehyde. Sorry about the German language here. And then further conversion into the vitamin A acid, retinoic acid. Okay, so basically you can, without a prescription, offer those same effects. It might take a little bit longer to get there, but the over-the-counter products can offer the same benefits. And these benefits are activation of fibroblasts, inhibition of collagen-degrading enzymes, the increase of proliferation of turnover, the inhibition of tyrosinase. So all of the things I introduced you earlier about the tretinoin have also been shown for over-the-counter products like retinol. So these are just a little selection of retinol studies, and there are good controlled studies on retinol now, which shows that compared to a vehicle, it has benefits. It increases the epidermal thickness. So this is a myth that we always hear from our patients, that retinol thins our skin. It doesn't. It thins the dead layer of skin cells on the skin surface. It does actually increase the thickness of our living epidermis and dermis. And so you can see all of those studies which really show that there is now good evidence for retinols, and that we can use this as a good alternative for those patients who might not want to use a prescription item. And then there are the advantage then of over-the-counter products is also that they can combine it with symbiotic ingredients. So if you use a tretinoin, you've got tretinoin, and there's only tretinoin in it. But there is a possibility of formulating really clever combinations of retinol with other symbiotic ingredients. And one of those is NAG, N-acetylglucosamine, neoglucosamine. It's all the same things, just different words for the same ingredient. And what it is, NAG is a building block for hyaluronic acid. So with that, it's a natural component of your glycosaminoglycans. And of course, the glycosaminoglycans make your skin plump and really hydrated from within. We know that HA binds huge amounts of water, but also it's really important for cell migration and communication between different cells. So it's a multifunctional ingredient. But sadly, it declines in quality and quantity as we age. And we do know that retinoids can increase HA to some extent, but we can do that even better if we combine it with symbiotic ingredients. Now, I have to burst one bubble here. I know there's a lot of hyaluronic acid serums on the market, and they're great for hydrating the stratum corneum, but I'm sorry if I'm the bearer of bad news here. Topical hyaluronic acid, even low molecular weight ones, do not replace your dermal hyaluronic acid. They can't do that. They're not penetrating that deeply. They're great for hydration, but if you want to stimulate or if you want to increase your dermal hyaluronic acid content, the only way of doing that is to somehow convince your skin to produce more, or you use a syringe. But topically, you have to really convince your skin, you have to trick your skin into producing more of its own hyaluronic acid. So one of the ingredients that does that is NAG. And you can see here that this was in vitro, NAG increased the hyaluronic acid concentration production by nearly 40%, which is a huge increase. And then there's a in vivo study done with a 8% NAG cream in photo damage. And in this study, it was shown that the NAG cream improved a variety of different clinical parameters, from fine lines, wrinkles, pore size, pigmentation, sallowness, to clarity, and clarity in particular I was very impressed with here. At week 12, there was a 70% increase of skin clarity, and today it's all about the glow, isn't it? Everybody is talking about that they want glowing skin. They're not really talking, when they come to see me in clinic, anymore about, I don't like these crow's feet lines. I can't remember whether I've ever heard this in the last year. They all say, my skin looks dull, please make my skin glow. And this is therefore very impressive. Pinch recall test, which is an objective assessment of skin elasticity, showed that also this NAG cream really, after 12 weeks, was able to increase the skin elasticity significantly, as did it increase the skin thickness and skin volume. This is actually the treated side, this is the untreated side. And then we can take silicone replicas, which exactly, and then measure them digitally to show exactly what the skin surface of your skin before and after treatment is. And in this study, the NAG cream was shown to improve both coarse wrinkles as well as fine lines with this method. And then there was another study done with NAG cream to look into acne. So it's coming away from anti-aging, and surprisingly, NAG also has a good effect for acne. So this was a study where NAG was compared to benzoyl peroxide, and this was actually a 10% benzoyl peroxide. And if anybody of you has ever used a benzoyl peroxide cream, 10% is so irritating. I don't really use the 10% anymore because it's just very effective, but way too irritating for daily use. And what you could see in this study was that it had the same, essentially, effect as a 10% benzoyl peroxide, which is huge, really, but without the irritation. So it wasn't as drying, it wasn't stingy or burny, what benzoyl peroxide typically is. So really, in summary, the NAG is a very interesting non-acid ingredient. It's a compound of natural hyaluronic acid. It will trick your skin into producing more of its own hyaluronic acid. And it can even improve breakout-prone skin, which is great for our adult acne sufferers, which of course are on the rise. I see more and more adult women with acne who then worry about not only lines and wrinkles, but also still suffer with breakouts. So this is 4%, 0.5% product by NeoStrata. And you can see here the synergy on HA production. So on their own, NAG produces or induces more collagen, as does retinol. But together, they more than double that increase of hyaluronic acid. And that's because they work via a different mechanism of action. So retinol induces the expression of this enzyme that helps with hyaluronic acid production. But NAG is a complementary mechanism of action, and it sensitizes the retinoic acid receptor. So it makes retinol and retinoic acid more effective as well. And that's why you get this more than additive effects, but in fact a symbiotic effect. So in conclusion, while tretinoin remains our gold standard prescription photo-damage and anti-aging ingredient, and it still does, retinol is no doubt now our over-the-counter gold standard of photo-damage repair and anti-aging effects. And combining this gold standard with symbiotic ingredients such as NAG can further improve the benefits without adding further additional potency to the skin. So this is a really good addition for somebody who might not prescribe or for patients who don't want prescription items. Thank you very much.